So we really do know that our supervisors make a significant difference to the progress of a nurse practitioner candidate through their education program. But we also realise that our supervisors, because we're choosing the best people, we're choosing people who are experts in their own clinical field, such as our medical colleagues, and they're busy people. And to actually be an effective supervisor requires a significant degree of input, and we realise that. So it's important that we provide you as a supervisor with the resources you need to do a good job. At the end of the day, you've got to carry on with your own job. It might be a medical practitioner or whatever else it is that you do in your role. And to enable you to bring the best of your experience to bear when working with our nurse practitioners, we produce this information for you to help you get a handle pretty quickly on what we would expect from a nurse practitioner candidate supervisor and where you can turn for the resources you need to do a good job.
We set up the role of nurse practitioner in New Zealand, one, because it's been around in the United States for at least 60 years with a very strong safety record and a very strong record of consumer satisfaction. So we know that it's the right way to go. We read the predictions around workforce need in New Zealand, and we can see, and as it's coming to pass, we could see then that New Zealand would struggle to provide services in a whole range of settings. And because nurse practitioners have that ability to provide the full episode of care, that means that they are able to step into the brink where big gaps are opening up in services. And I think one of the things I've learnt from my own research is that nurse practitioners have a very strong sense of team and of the value of the other people who work in the community or in hospitals, and that the team is always bigger than any one person in terms of providing care. But they are happy to go alone, and they are totally responsible for what they do. One of the things we know from overseas experience is that when people have had a nurse practitioner provide their care, they then know what that role is, they know how that person works, and they express really high levels of satisfaction in all of the research evidence. In New Zealand, we have a situation yet so far where very few people have come across a nurse practitioner. And so as we gain more nurse practitioner positions, we'll gain a much higher level of awareness both from our medical colleagues as to who these people are, and from our population as to what nurse practitioners can offer in terms of the gaps that are very clearly there in service delivery.
Emergency departments, I know other areas of health as well, volumes are expanding, so it's actually looking at your workforce, and nurse practitioners are a really good value actually.
All I can say is that if I was starting my career now, I wouldn't even think about not being a nurse practitioner. It's not for everybody, but I think people who want to stay in clinical practice for the duration of their career, but reach a level of seniority and to be fully extended and challenged and recognised for the contribution they make, then becoming a nurse practitioner is really an obvious choice.
I think it's a really important thing that somebody's doing. And I think it's important that whoever's doing it has got some skills and knowledge of what the process is actually about. And that's the key bit. I think it takes you a while to actually get into the mode of supervising nurse practitioner candidates. Once you're there, it's fun and it's self-sustaining. It's still hard work. So I always say yes. They've gone through their Masters of Nursing. They've got a very strong sense of what nursing's about. And I've got a very strong sense of what doctoring's about. And it's not a collision, it's a working together collegial relationship, which is what makes the year fun.
But an essential part of this is that those nurse practitioner candidates are supported on that pathway, and that's where the role of the supervisor comes in. So as a supervisor, we're looking for people who've got the skills in their own practice area, be they nursing skills or medical skills or academic skills, and they're going to bring those skills to bear in this candidate's life and experience as a student nurse practitioner, and will really help them get on track, be able to assimilate their academic learning from a classroom situation and apply that in real life practice. So that supervisor role is essential to making this candidacy pathway for a nurse practitioner work really well.
This project is about supporting supervisors of nurse practitioner candidates or nurse practitioner interns, and it's really an opportunity to value the role of the supervisor. It's such an important role, and what we want to do is provide resources to support that role to be done to optimal effect.